Hi, my name is Nidhi Sharma. I'm a pelvic health physical therapist and I'm here today to talk to you about incontinence, or what we call as leaking. Leaking can happen quite commonly in women after pregnancy. It's actually more common than most people think. Almost 50% of women having the baby first time will experience leaking of some kind during pregnancy or after. Having the baby second or third time, this ratio actually goes up to 80 to 90% of women. It also is not a short-term problem. Most women tend to think that it will happen after pregnancy and then it will go away by itself. That does happen in some cases, while 50% of women will have leaking consistently years after having the baby, or forever if it's not managed. This leaking problem, as it goes through the decades of life, will consistently get worse. Around menopause, this leaking problem can get a lot worse as estrogen decreases in the system. So it's not okay to ignore, it's not okay to leak. I think in a nutshell, we can say that if you're leaking with coughing, with sneezing, with running, with any activity of daily life, it's not normal. It's not okay to ignore it. It's not a thing that's going to go away by itself. But to manage incontinence, we have to understand why incontinence happens and what happens in the pelvic floor or pelvis that causes this to happen. So for us to understand why leaking happens and how to manage it, we have to understand the anatomy of pelvic floor. This is the pelvis, this is the bone on the right, this is the bone on the left. Bone in the back, lower back, your tailbone, this is the bone in the front. So we're basically cutting the top of the pelvis and looking inside. When we look inside, these are the major organs inside the pelvis. This is the bladder where you collect your pee. This is the uterus where the baby is. And the back is the rectum where the poop is collected. Now, if we remove these organs, the big red sling or basket-like muscle that is visible inside is pelvic floor. Pelvic floor, like you can see, is a big sling, is a big basket which supports the organs and other fascia and things inside the pelvis. When we flip this over, you see the three openings in the perineum. This is the vagina, urethra where you pee from, and anal opening where you poop from. And as you can see, all those three openings are actually openings inside the pelvic floor muscles. So when these muscles contract, they have the ability to close these openings. When they relax, they have the ability to open these openings. And when they're weak, injured, strained, torn, they cannot contract as efficiently as they need to. On top of that, when you're coughing or sneezing, or having some sort of increased pressure coming through the top of your pelvis, like cough, sneeze, laugh, run, these muscles need to work even harder to close these openings. The weakness, the injury or tears that happen during the pregnancy or during childbirth can make these muscles very weak. Good news is that we are able to strengthen these muscles. We are able to make these muscles stronger. These muscles are inside, so they're not visible, they're not easy to see, they're not easy to understand, but actually these muscles are just like the muscles of your biceps or the muscles of your legs. When those muscles get weak, you can strengthen them. You can strengthen them to make them work harder, make them work more efficiently. Same things with these muscles. These muscles can be strengthened. They can be taught, they can be trained to increase their muscle mass, to increase their endurance, to increase their power, and we can teach patients how to efficiently close these muscles when there is more pressure coming through the pelvic floor. So, to conclude, it is totally possible to stop the leaking problem from happening. It's absolutely not normal for any kind of leaking to happen. Coughing, sneezing, running, laughing, jumping, all of those activities should be completely leak-free. If you're leaking with any of those activities, any other activities of daily life, talk to a pelvic floor physical therapist or give us a call. Thank you.